Again, thank you so much for being here. I'm very proud to be here tonight. And quickly, I want to introduce someone very important, Craig Fraley from Clark County Credit Union. Clark County Credit Union and Craig have been friends of Roseman's for a very long time. And without them, we would not be able to do this series. So please join me in welcoming Craig.
Thank you. Thank you for the big round of applause. Appreciate that. Some of you have heard this before, but we are very proud to sponsor Roseman's Neighborhood Health Series. We are the credit union for the health. We're actually chartered for the health field. We're basically the credit union for policemen, firemen, and medical, but anybody can join. So the qualification is breathing. And there's a magazine out on the table. Please help yourself. Somebody already took one. Great. Don't wait for the movie to come out. It's a really good read. The best page is the last page. That's where they hid me. And just to let you know, we are not for profit. We're owned by our membership. So at the end of the year, we give all of our profits back to our members, unlike banks who keep all their profits. And if you have an allergic reaction to the banks, we are the cure. So yeah, check it out. If you have any questions, give us a call and we'll make up something that sounds good. All right, everybody, enjoy your evening.
Great. Thank you, Craig. And thank you, Clark County Credit Union. So as many of you know, I plan these events very, very far in advance to make sure that we get our speakers and our guests lined up and they know what to expect, et cetera. And it's been such a long time that Connor and I spoke about this potential topic. And we talked about it sort of in relation to post-COVID, during COVID, the amount of misinformation that was out there. And the really nice thing about Connor is we collaborated on this topic and he really took it home. And the very nice thing is he is up in our South Jordan campus. So as many of you know, our primary campus is in Henderson. This is our Summerlin campus, which is currently in the process of being expanded quite significantly. Some of this empty land that you've seen around here is going to finally be built on. So it's really, really exciting. And then our South Jordan campus in Utah, we have many of our same programs, our dental program, pharmacy, nursing, et cetera. So Connor flew down here this morning and is flying back tonight. And I'm very, very excited to introduce you to him. He is also a librarian. This is really important because as much as we think of the librarian being very skilled in the Dewey Decimal System, that's not necessarily what he does. And someone very smart today brought up the fact to me that in academic institutions like our own, librarians are critical to many, many people. They have access to information that not the regular lay public has access to. They support researchers, they support faculty, they support students and everything that they're doing. And they are a resource that is used all the time. And so that's why we're also very excited to have Connor. So for over 10 years, Connor has worked in the field of information science. He's worked in both public libraries and academic libraries and has developed a strong sense for the different information of each. You may know him through his work as a research and learning librarian at Roseman, University of Health Sciences. He graduated with a Bachelor of Arts in History Education from the University of Utah in 2020 and with a master's in Library and Information Science from San Jose State University in 2021. He currently lives in South Jordan, as I mentioned, but he grew up in Carlsbad, California, which is not a bad place to grow up, by the way. He spends his free time playing and learning to play a variety of instruments. And he listed many of his instruments. Some of them I had never heard of. So let's see if you've heard of them. A few of the instruments that he plays are the trumpet, yep, ukulele, bagpipe, piano, hurdy-gurdy. Has anyone heard of a hurdy-gurdy? And the concertina. So you, after this, you're going to have to tell us a little bit about your instruments. So please join me in welcoming Connor Schwartz.
Hello. I take the mic is working because I can hear myself very well. You will see me using my phone. It is going to act as my clicker through the PowerPoint. And at times in this presentation, I will actually be asking you, since I'm up here, I'll take this off, to pull out your phones and take part in some surveys. So let's go ahead and get started. So we're looking at finding the truth in a sea of misinformation. What does that even mean? Really, we're going to be looking at how do you find reliable resources for you to make informed healthcare decisions. And a big part of that is health literacy. So you find this resource and it looks great. You think you understand the subject matter, but is it reliable? So as we're kind of going through, we're asking continuously, what is health literacy? And the CDC actually has a definition for it. They break it up into two categories. There's personal health literacy and organizational health literacy. Today, we're going to focus on the personal portion of health literacy, which they define as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So now that we've got a basic idea of what it is, a general definition, why is it important? Well, I kind of already said it, and it's one of the key takeaways from that definition is that you need to have an understanding of how to find reliable information, not just so that you can understand it, so that you can use that information to make decisions about your healthcare. Because, you know, as much as we love our doctors and we do need them to help us make the appropriate decisions, we should be coming in with an idea of what we're looking at so that we can say, okay, I looked at this, it looks really good. Do you think that it'd work in my situation? And, you know, sometimes they are going to say no, but it never hurts to know what you're talking about before going to your doctor. So when we are searching online, I'm sure we've all come across it before, there is mountains of misinformation and disinformation. How do we navigate through that? And honestly, why do we keep searching online when we know we are going to find so much false information? A good example, there is a website that is still up. It's been up since 1998 to save the critically endangered Pacific Northwest tree octopus. It's still up. It's labeled as a hoax. The website now is more a joke than anything. But when it first released, people actually believed there was a tree octopus living in, I think it was Olympic National Forest. And it's a favorite food of the Sasquatch, just as a fun tidbit. But it's an example of why maybe we shouldn't search online, but there's so many reasons why we do. So as you see on there, we talk about availability. Most of us have the internet in our pocket. We're able to get online and find any information we want on almost any topic getting into coverage. Like I would never have thought to find information on a tree octopus online, but it's there. Of course, someone made it up, but it exists. Convenience, again, it's in your pocket. It can't get easier than just reaching into your pocket, pulling out a phone and going, oh, here's that information about this topic that we were just talking about. Affordability. Now, not everyone does have a phone in their pocket. Not everyone has access to the internet immediately at home, but the public library offers free access to the internet. So anybody can access the internet and use it to access information. But to the biggest points in favor of searching online is the last two. Wow, I lean into that. The interactivity and the anonymity of it. So if you go online, you can talk to someone that's maybe been in the same position as you and find out more about how they dealt with it, what they went through, and relate with them. But you don't necessarily have to share any information about yourself with them. You don't know if they're a real person. There's some issues there that we won't get into today. But I know personally, I wouldn't want to go to a group of people and start sharing things like, oh, I've just been having uncontrollable diarrhea for the past 4 months and it's terrible. And I'm not going to go to a group of people and say that. I might on the internet because no one's going to know it's me. It's a lot less embarrassing. So with all these reasons we go online, let's start with our first kind of poll. So up at the top, you'll see a website, www.menti.com. If you go there and put in the code 1634858, you will be able to submit your answers for this. You can use your phone, and the student Wi-Fi here should be the easiest option for you. There are no passwords on it. and I'll give you guys a few minutes. If you have any issues, just raise your hand. I can come by and help out. All right, so we got one. I guess I didn't read the question for you. I jumped straight into it. How many of you have gone online to look for information about a potentially serious medical condition in the last year? So far, it's pretty unanimous, which I did not expect. All right, there's one for have not. All right. If you still want to submit, you still can. I'm just going to start talking about what we've got there. So this is actually going to be really interesting because based on our small sample size, it goes completely against the actual statistics I found for this. But that makes for a very interesting conversation. So we've got, out of 10 people that have submitted, 90, now I'm not good enough at the math. We've got close enough to 90% of people saying, I've gone online to find information about a serious health condition versus less than 10%. So the actual statistics I found were, and this was from a study from 2013, so it's a little old, but the information I think is still good. If anything, numbers probably have gone up, although I doubt anywhere near as high as we are currently. But 35% of adults usually go online within a year to find information about a specific medical condition. Now, of that 35, 46% sought the attention of a medical professional, 38% addressed the issue at home, and 11% kind of did something in between. They may have talked with a doctor, but didn't actually do anything they said and just took care of it at home anyway, or they started to take care of it at home. It went horribly wrong and they went into the doctor, somewhere in between the two. Now, this begs the question though, like how often when these people were diagnosing themselves by what they found online, was it accurate? I don't know how many people remember it as a joke that WebMD, no matter what symptoms you put in, would come back with cancer. You could put in, oh, I've got a runny nose, a cough, and a headache, and it'd come back with some form of cancer. Now, that's not strictly speaking true, but I always did find it funny. But when these people went online, of the ones that did look up a serious health condition, 41% actually had a medical professional confirm their diagnosis. 35% didn't go in to visit. That matches very closely with our stats previously. And 18% reported that their diagnosis wasn't confirmed, with 1% saying it was inconclusive. So talking to your medical professional after you have an idea of what might be wrong with you is always a good idea. And even if it turns out that they disagree with your diagnosis, they have a better idea of what you think is going on with yourself, because you know what symptoms you have better than they do. You're experiencing them. So we're going to come up on another poll really quick. So for this one, we're looking for general health questions, and this can be anything. Let's see, I've got a pretty long list for myself here. So it can be for serious conditions, It can be for just medication management, making sure that the medications you're on are appropriate, preventative care, anything from and including how to properly brush your teeth. Hair care would count, minor health issues like some indigestion, which could result in a more serious condition. How to select the best health insurance, looking up the quality of doctors or hospitals in your area. When we're getting into general health, it is incredibly broad. And we're at the same number as last time, I believe, or maybe one more. Perfect. I love it. So this is going to match up more, although we're still skewed, but you know, with such a small sample size, it's okay. With this one, we're seeing 72% of adults report going online to look for general health information. Now, this probably rose, just like the last one did, between when this survey was done in 2013 and now, and might actually be a lot closer to the 90% we're seeing, but I can't be certain of that at the moment. Keep forgetting I'm using my phone. So this is the last, well, no, it's not the last, but it's the last for a minute. I want to know where your searches began. So if you went online looking for general health information, where did you start? Did you go to Google right off the bat, a search engine? Did you go to Wikipedia? Did you hop on WebMD or the Mayo Clinic? Where did you start? And you should be able to type in your answers and send them in, and they'll pop up. There we go with Google. I knew Google was going to show up. Medline Plus was then, I don't know then, if it's a search thing or if it's meant to be like Google then Medline Plus. Is it just spinning them around?
I think it's bigger with
Oh, does it? I like that. I haven't used this specific one yet, which I guess most of us started at Google then. ChatGPT. All right. Wouldn't have been my first stop, but I didn't expect it. So I'm actually kind of interested to talk to whoever put ChatGPT. So we've got a bunch of good places to start. I'm very happy to see nobody started their health questions at Wikipedia. I was kind of worried we might see that. So let's go ahead and kind of look at the stats then that follow out of that. So 8 out of 10 online health information seekers started with a search engine. You know, Google, Bing, Yahoo, DuckDuckGo, all great places to start if you really don't know what you're looking for and you need to get a general idea very quickly. 13% started in a specialized health like Medline Plus or WebMD, which we definitely saw on there. Unfortunately, there are 2%, which are not present here, I guess, that did start at Wikipedia or even started their search on places like Facebook or TikTok. And we'll kind of get into that a little bit more later. It's harder to verify on a social media site a lot of the time. You have to go elsewhere to actually make sure the information's good. That being said, I lied earlier when I said it was the last for a while. How many of you, when you went on for your health information search, were looking for somebody else? Did you go on to find information for your own benefit, or was it for another, or was it for both? Like you were both suffering and you went, well, it sounds like the same thing. Might as well look it up. Interesting. I like it. I like the unsure. Fascinating, like almost dead even, except for unsure, which we will talk about why that's great in a minute. Okay, this one's really interesting. So half of the people submitting are, more than half are submitting for, looking for both. You know, I wasn't feeling well, they weren't feeling well, we both looked into it, or I looked into it for both of us. And pretty close to that is looking for yourself, which actually does match up fairly well with the statistics I've got. So over half looked for information on behalf of someone else. So 39%, and when they are making, when I took that statement from the Pew Research study, and they are adding in that 15%. So really the stat almost becomes over half looked for information on behalf of someone else, and over half looked for information on behalf of themselves, which feels weird statistically, but it makes enough sense. So we're following this very closely. Which after the other ones, I didn't expect at all. So we're going to keep going. And there's some more statistics to look at. We'll probably get through these fairly quickly, hopefully not too quickly. So when asked how often we're seeing health information as Americans, and this is a different study from, have to check the date, 2019. So much more recently, just before the pandemic started. How often were Americans seeing health information? Well, 16% said every day. Something came on the news every day about health, and they saw it. I don't think most Americans are actually watching the news every day, though, so that may account for that. 40% saw it a few times a week in passing. They saw it in the newspaper. They were just watching the news, and it popped up suddenly. 28% saw it a few times a month, and 15% saw it less than a few times a month. So this is a good example. Like even at 15% with less than a few times a month, we are seeing health information in our lives, whether we're looking for it or not. So we need to be able to tell not just when we go looking for this information, if it is reliable, we need to be able to tell if it's reliable when we come across it in the wild, as it were. So what about conflicting health information? This is the same 2019 study. So in 2019, we already were getting hit with waves upon waves of misinformation related to all kinds of topics. Now, at this point, US adults reported seeing conflicting health information 13% of the time, all the time. 50% saw it some of the time, 29%, not too often. They were pretty confident they weren't getting that conflicting information. And 6% said, we're not seeing this at all, that it doesn't happen. Now, with that, the same study asked Americans if it made sense for there to be conflicting information like that. And I'm really happy with the 74% saying it makes sense, especially with health and the sciences. We're developing our understanding of these things. So as new information comes out, sometimes it's going to disagree with some older information based on what we know. 23% said no, it should never conflict with each other. We know what we know. Now, with that, we get into a lot of misinformation, because misinformation kind of feeds off of that 23% that are saying, no, this makes no sense. And they go looking for an alternative opinion. And in some cases, it's not all the time, because we will talk about people that tried to verify and still shared some misinformation. So misinformation, fake news, disinformation, it is a massive topic. In 2020, the World Health Organization labeled misinformation as one of the top 10 issues facing healthcare in the next decade. And it's been an issue starting back in 2014. The European Union actually put rules in place to try to control misinformation. They haven't been very successful yet. And as we get into it, we'll kind of see why it's such a nebulous thing to try and control. The other part of this that I do want to talk about really quickly is the difference between misinformation and disinformation. Misinformation is any information that have the exact definition from the Surgeon General here. incorrect or misleading information that is put out there. Now, it becomes disinformation when somebody purposefully shares it or puts that information in a place where it's actually meant to lead people to believe something that is incorrect. And, that's kind of what we're going to be watching out for today. We're going to talk a lot about misinformation because we're going to hope it's not disinformation. Going to be a little optimistic with it. So let's talk about some of the associations between misinformation, health literacy, and COVID-19. So I don't know if any of you have heard of the Dunning-Kruger effect. It's one of my favorites. Overconfidence in your abilities leads you astray. You don't come out on top in that situation. And that happens a lot with health literacy. People are overconfident in their ability to actually analyze information and make sure that it is reliable. Those that report adequate health literacy usually did a bit better with verifying their sources' reliability than those that reported high levels. And this is a study, I believe, from 2017 that was looking into this. And as they kept going, this one is actually, I think, 2022, 2021. And as they went through, they just found people were reporting their health literacy, it vastly differed with the observed health literacy. And that Dunning-Kruger effect definitely factored in. They also found that those with higher health literacy were more willing to get vaccinated against COVID-19 versus those with lower health literacy. And the lower health literacy group was associated with believing that the pandemic response was an overreaction. That one, I think, was a little bit more mixed, but the lower health literacy did have a majority believing that. So some of the most common types of misinformation that we are going to see. Memes a lot of the time. So kind of like what we've got here. It was shared on Facebook, so it must be true. Meanwhile, this guy's standing under an ice floe, a very dangerous situation. I take it as meaning that, taking information from Facebook is dangerous as well. But that's kind of one of the beauties of memes and scary things is you can interpret it how you like. We've also got websites. So we talked about the Pacific Northwest tree octopus. There are websites out there specifically meant to give you false information. Some of them are known hoaxes, like the tree octopus. Some of them are a lot more tricky. Altered quotations. So taking something somebody has said and altering it so it matches your agenda. I unfortunately don't have a specific example at the moment, but I'm sure we've all seen that somewhere. Cherry-picked statistics. 100% of 200 people have agreed that cherry-picked statistics are great for you. That's the other downside of statistics. You can make them up. I will show you my references so you know that I didn't make up my statistics. Misleading graphs or diagrams. I could create a pie chart that shows you all the different percentages, but makes one look a lot smaller than it actually is. So it doesn't match up with its actual percentage, but is convincing enough. Old images, they are often used to try to, for me, it's more a historical and news thing. They're using old images to make it sound like something happened yesterday when it was 10 years ago. And then we've got edited videos. Much like altered quotations, they can make a situation look like it is one thing versus another. And so these are things we have to watch out for. And these are the most common types of misinformation, according to the Surgeon General. So once we start getting into misinformation, what kind of misinformation we're seeing? Has it left Americans confused? 64% felt like Americans were really confused. 24% felt there was only some confusion. And 11% felt that there wasn't not much to no confusion. I think those statistics are an example of the American population's confusion. Oftentimes, we don't know enough about how to verify a source to be sure that we don't share some misinformation or in some cases purposely share something we know is false, which kind of gets into why are people confident in their ability to tell the difference between reliable information and misinformation. And it's kind of torn. And most people feel somewhat confident, but we have to watch out for that Dunning-Kruger effect. They may be very confident, but actually really terrible at it. And we've got 16% feeling not very confident or feel like they don't know at all. And so we have to watch out for these things, and hopefully it prevents us from doing things like this. So do we share misinformation? I am willing to bet everybody in this room has shared some kind of misinformation at some point, not intentionally, like maybe somebody, but I feel like most of us here would have shared one that they found out later was made up. 16% of Americans reported that. 14% shared stories that they knew were made up, which to me is upsettingly close to the 16% that shared accidentally. And 23% did either or both. And I don't know what concerns me more with that. But with sharing the misinformation, where do we go for, who do we go to if we actually want to get a reliable source of information? Now, the next slide makes me very happy as a librarian for a very obvious reason. We're at the top of the chart. 40% of Americans trust librarians to give them good information. I'm not pleased that it doesn't break at least 50%, but I'll take being at the top. Healthcare providers are after that. Family or friends have, to me, an inordinately high amount. Unless your family or friend is a doctor or a librarian, I don't know if you should trust them quite that much, especially with health information. And it just goes down from there until we hit the very bottom. So 30% of Americans say they do not trust any information source a lot, which is way too close to the amount of people that trust librarians, in my opinion. If they could just, trust just librarians, I'd be happy. But we are stuck at a point where that confusion from misinformation, not being sure we're sharing something that is true or not, is so pervasive that a lot of Americans do feel like they can't trust any source of information. They can't trust their doctor to give them good information because they don't know where they got their information. They can't trust a librarian because librarian will probably show them where they got the information, but how do they know they can trust the site the librarian went to? And so with that, how do we find reliable resources? Well, this is where we get back to that person that said unsure earlier, which is absolutely beautiful, because you should come in being unsure. Come in with some serious doubts and question everything. In fact, there are a few questions we're going to talk about that you should specifically be asking of every resource, whether it is online, whether it's on the news, social media, anywhere you find information, you should be asking these questions to make sure you are getting the most reliable resource. So first, we're asking who? Who paid for this? Who created it? Now, it should be clear if it is a reliable source of information. They should automatically say, oh, we are supported by this group, this organization, this school, this government. And you can usually tell that by looking at the web address, thankfully. .gov, as I'm sure most of us know, indicates a government-sponsored site. .edu usually indicates an educational institution. .org normally indicates a non-commercial or professional organization. So like the Medical Library Association is MLA.org. Or .com, which is usually a commercial organization, a company. The one thing to watch out for with this, so in the paragraph above that, it does say you can usually trust government agency, medical schools, and professional or nonprofit organizations. With professional or nonprofit organizations, you need to watch for an agenda. Some of them are coming in with an opinion that they want to convince you of. So if you see that, verify that somewhere else. If they make a claim, find another website that you know is reliable that will verify what they are saying. And we'll get more into that in a second. With this, what is the purpose? So Medline Plus, I think, said it best. I didn't want to change it. So there it is in quotations. A trustworthy website has just one goal: to provide you with good information. So of the three listed there, the questions to ask, is the goal to inform the public? If the answer is yes, you're in a good place, or you're on the right path at least. There's still more questions to ask. Does it sell a product or service? Does it promote the ideas or opinions of a specific person or group? That's the one you're looking out for with organizations. They oftentimes are trying to promote a very specific agenda. And I saw so many people nodding and like, yeah, you got to watch out for that. It really does make me happy to see that. So with a product, you can't just trust that the product is going to be what everything you hope for, everything they claim it to be. They are going to be biased, or most likely are going to be biased. If they really have a miracle product, they might not be biased and might be underselling it. Not likely, but it could happen. So you got to watch out for that bias of they are trying to sell you their product. And this applies to advertising too. If you notice that the website has a lot of ads for a specific product, but they're not selling it on the website, chances are they're getting some money from them. They probably will be biased in their favor so they can keep getting that money. Now, if it makes significant claims, verify it through an unaffiliated source. You can't go to, so if it's an advertising thing, you can't go to the website for the product and go, oh yeah, they both agree. That's not going to work. You need to go somewhere that has no connection to the product or the ads to make sure that this is good health information. And then you're going to ask, when was the information written or reviewed? Out-of-date information can be dangerous. You wouldn't want to go into your doctor for an asthma treatment and be given cigarettes and chloroform, both which were used to treat asthma. I don't even know how far back. You do not want that now, because now we know. So you want to make sure you have the most up-to-date information. Unfortunately, news reports aren't usually getting updated with new information as we find it out. So using an old news report, I would say anything more than a year, don't look at a news report. You want to make sure you can verify the age of the information. They should have, and we'll see it later, I'll point it out. At the very bottom, usually there is a date that says it was most recently reviewed and updated on this date. And that usually indicates that it is a good source of information. Now, they have a reliable website or organization will have policies in place for reviewing their information. And you can usually find these policies to read for yourself to verify that they're doing the best practices in this situation. Some provide names of their reviewers. Some have boards specifically for it. And some, make sure that you have the ability to contact them. And a reliable website will provide contact information so that you can reach out with any potential issues. Or if they want to have the option, if they post something that is heinously wrong, they want to have the option to have someone reach out and go, hey, I saw you put this on there. That's not accurate anymore. Now we come up to our next poll. What about links? If you come across a link on a website that you have already looked at and verified is reliable, can you trust the links on that website? Well, I will wait to see what people think. Again, I love the unsures because you should come into this unsure. Okay. All right, well, the unsures have it this time, which is perfect because you need to get more information. Oh, a little close now. Ooh. All right. So we're a little unsure and we're saying no, and one person's saying, yes, you can trust them. Sometimes you can, but you need to make sure first. So some of the things you're looking for when it comes to links on websites is you need to know what their policy is. Are they being paid to put these links on their website? If so, we get back into that bias because they're being paid thing. So you don't want to trust those links. Some of them have very strict criteria for any information that they link to. It has to meet their very specific demands, and only then will it be linked. You can usually trust those websites that they link to if they have a strict policy. As a general rule, if the link of the policy of the website isn't, if the link policy of the website isn't strict, don't assume that any of the links are going to provide you with reliable information. Go through and verify them for yourself. And it's going to come down to that a lot. A lot of the time you were going to just need to kind of bite the bullet and get in there and do it yourself. And, hard to go wrong there as long as you have an idea of what you're doing and you talk with a medical provider afterwards. So the next question we ask is, where are they getting this information from? As we've talked about, information can come from anywhere. It can be made up very easily, and it can be made to look reliable. So when you're asking where, look for citations, links to where they got their information. You should be finding a lot of sources coming from reputable medical journals where they're condensing the information they found to be presentable to the general public. I still struggle reading articles in medical journals. Half the time they sound like gobbledygook to me. So I appreciate getting these websites that narrow it down and make it understandable for me, who is not a healthcare provider. And, if it isn't from a source like a medical journal, verify that website as well. Make sure that they're not making it up and then being quoted in another place. Which brings us to our next little survey. What about Wikipedia? Can we trust Wikipedia? I think most of us in here are going to put the same answer down. This is what I was expecting. Although me saying that has now skewed it. Ooh. Okay. All right, so at this point, we've got a majority saying, no, you cannot trust Wikipedia. 3 are unsure, and we've got 2 yeses. So I would not trust Wikipedia, not at face value. You'll have to go into the sources themselves and verify those. Because, it is on this page. And I'm going to quote Wikipedia here. They actually have an answer for whether or not you should trust Wikipedia. Wikipedia says, as a user-generated source, it can be edited by anyone at any time, and any information it contains at a particular time could be vandalism, a work in progress, or simply incorrect. So it could be that the citation that it's citing is saying, this is where this information comes from, is actually a good source. But what it says on Wikipedia is something completely different that has nothing to do with the citation. So you cannot trust the information you pull straight from Wikipedia. Go to its sources, look at them, verify them. Mostly because Wikipedia is constantly changing. And I unfortunately agree with the vandalism part. Not even a matter of agree, it's a statement of fact. So after we've asked all these questions, I've said it a couple times already, but what do you do now that you've verified this website, you found some health information? that you think is reliable, go talk with a medical provider. Don't take it as gospel. Make sure that you are talking with them and verifying that what the information you found is what's best for you. Because you may be looking at this one specific aspect of your health. And as a layperson, that's what I'm going to do. I'm not going to look at how it's affecting every other part of me. But a medical provider will have a better understanding of the interactions between all the different parts of your body and the different illnesses you may have. And they can provide that perspective. Now, a large percentage in 2013 did see that their diagnosis at home with the information they found was being verified. So you may go in and your doctor goes, oh, wow, you know what? I think you're right. But just in case, for that smaller percentage that said they completely disagreed, make sure it's not dangerous for you to start treating for that on your own. Now, I'm going to show some just good places to start, and then we're going to do a really quick example using the topic of sleep apnea. But some really good places for you to start if you don't want to start on a just general search engine. Medline Plus is a great place to start. It is a government-run website intended to spread health information that is most up to date with the research. You can link to there from the National Institute of Health, although Medline Plus is actually run by the National Health Library, the NHL. And CDC is also a good place to go, as well as the World Health Organization. You go into these websites and they have articles on, I couldn't even begin to count how many health topics they have available to look at and get some good information. And you can usually trust their links, and they will actually link out to other reliable sources of information that you can then build on your search with. So let's get into an example. So I'm just typing in sleep apnea, and let's see what pulls up. I don't want symptoms. So we've got the Mayo Clinic right off the bat. National Institute of Health, which is typically very reliable. Sleep Foundation, Cleveland Clinic, ends in .org, so probably reliable. I actually know the Sleep Foundation. They're a good source of information. There's WebMD, Johns Hopkins, Wikipedia, of course. Unfortunately, it didn't pull up what I was hoping it would. So let's change my search a little bit. I am going to say that I don't want to use a CPAP. I don't like sleeping with a mask on my face, a machine blowing air. It's too noisy. So I'm going to go and just add no CPAP and see what pulls up. So I've got this, Inspire Sleep. So clicking in, I see it's a .com, so it's a commercial company. They're trying to sell something. I am automatically a little suspicious. I'm not going to trust it. I'm unsure. And I can go through and look at what all the claims they make. There's these claims, but they do cite sources. So I can open these up and see what they are. Just accept that. This is in Sage. A lot of authors. All right. So, and it is coming from the Journal of, I can't pronounce that, Head and Neck Surgery. So this is a reliable source for us to be looking at to get the information that they're getting, which normalization scores increasing from 33 to 78, 15 to 67, which I think, I don't understand it enough to say it matches up exactly. That's the upper airway 2018. Okay, so it lines up with this one and this one, which I did read that one, I remember that. And let's look at our second one. post-approval upper airway from the European Respiratory Journal. So already we're looking good again. I was half expecting to come in and tell you don't trust this website, but I'm believing it. We know that it's created by a company trying to sell this. We know where they're getting their information. Of course, we don't know what their process is for reviewing it or making sure it's the most up to date. But based on where they're getting it, it's fairly up to date information within the last 5 years, which is really good. And then one thing I did want to talk about that I forgot about when I clicked on the link was it's sponsored. So a lot of us probably have that kind of built-in, don't trust a sponsored link. Verify it, but you can trust a sponsored link. The only real thing that happens if you click on a sponsored link is that they're paying for it. And then it goes to show that sponsoring the link works well for them. But you can go in and click on it and verify any information you find. And you can actually verify it elsewhere as well. And with a website that is selling a product, even though this one looks good, I'd still want to go out and search for it elsewhere. So I'd be putting in Inspire sleep apnea device, and I'm just going to do a Google search. And then I'm going to put effectiveness, if I spell it right. Oh, I'm not. Okay. Let's do that. Okay, sorry about that. So we're just going to look for effectiveness, and we're going to look. So we've got the University of Kansas, which is showing some effectiveness. Mayo Clinic is talking about it. And they're showing a decent reduction, although less than what they reported on their website, 68% versus I think 74, 79. Still significant, but not quite as high as they were. And here's the Sleep Foundation. And we can generally trust them. We know where they're coming from. We know who the writer is. And they talk a bit about what it is and its success rate. So overall, I would say you could trust Inspire. I'm able to see here in the Sleep Foundation that they do verify significant increases, maybe not the exact same numbers, but I may be looking in the wrong spot for that. And then also University of Kansas also does verify those results, though this one I would be more reluctant to trust. Anyone want to guess why? This is the University of Kansas Health System. Yeah. So they are providing the Inspire. I don't know what it is exactly, but they're providing it for their patients. So they are ostensibly getting some money from it. So a little reluctant on this website, but the Sleep Foundation, to my knowledge, does not have any connections to Inspire to promote them saying yes. All right, and we're going to call it there. We can open it up for questions now. We'll bring a mic over in just a second. Hands up. I think his back was turned at the moment.
Thank you very much for a very informative session. And my question is, I never really closely looking at those like sites, like Mayo Clinic and such, whether it says link or not. But what's your opinion, generally speaking, about those the hospital sites, or how
So-
reliable they are or not? Or should I apply exactly same thing you
Mhm.
said? Or
So
not?
generally speaking, always verify it, at least to some degree. Even the ones that I have said are good places to start, still go in and verify that those websites are going to be good sources, because no one website is going to be accurate 100% of the time. They're going to try, but so expand on what you mean. Also say it in the mic for the recording.
Let's say Mayo Clinic, and they have, website, and they describe, your conditions, this, and this could be illness, and this and that. What is their motivation to post those information on site?
So with the Mayo Clinic, I don't know specifically what their motivation is, but I do think that they are, as an organization, there to promote health in general. And so they're actually one of the websites that you can often trust. I kind of leaned towards trusting the government websites in that last slide. But they are a website that has been found to be reliable on this information very frequently. And I do think it's because their motivation is just to make sure that we are as healthy as we can be, that we have that information.
I just had a question on, you had said to make sure that you know who they're sponsored by, the websites. Where do
Mhm.
you usually find that? Because sometimes even like in the About Us or section, it's not there. So like,
Mhm.
how do you generally look
So-
for that?
You always watch for it when it's going to be obvious, which is a given. If you see an obvious ad, you can get an idea that maybe they're a sponsor or they're selling a product. But when it's a little more sneaky, sometimes they're trying to slide in under the radar. You're looking for if they're offering services, if they talk about, oh, they may say something very brief, like we're connected with this company, but not expand on how. So when you see something like that, you can automatically jump in and go, okay, I need to look more into what their goal is, what's going on here, because it feels off. Like it doesn't look right. This one little bit of information didn't provide me with enough to tell me that they are not affiliated with a product.
So any website there that you say good to start, are they privately funded?
Yes, all of those ones are either government funded or in the case of the World Health Organization, I guess still government funded, but not just one government, which
But
I
is
like.
CDC also is a private company?
No, it is a government funded.
And so how do I look up when, just same thought at her question, government funded, but there's a
Mhm.
private company also giving money to this?
That is where you get some complications. Yeah. So you can have government funded websites. Usually they're going to be very trustworthy. Sometimes you can get some politics bleeding in, and that's a lot harder to track in this context, because you can get an idea of if they come out with something that seems to go against all common sense, which thankfully doesn't happen very often. You can usually associate that to some kind of political movement that is being supported by this one specific group. But with these organizations, it's going to be really hard to track that down and make sure that that is what's happening versus knowing with any certainty. Does that make sense?
Yeah.
No, that's exactly what you should do. It very well could be. Yeah. I love the adage, trust but verify. Take that information, take it at good faith, but make sure it's true. And it really applies, especially with information. Where'd the mic go? Okay. we'll come back.
Is there any scenarios or situations where crowdsourced information like Wikipedia and like Reddit can be a good source of information?
So it's a difficult question. There are, if it's not something that can alter your life, sure, you could use Wikipedia or Reddit to find out how to function or run something specific. Is it recommended? Not really. But for something as small as I went on Reddit to figure out, my son got a electric train for Christmas, and I couldn't figure out for the life of me how to make it run. The instructions it came with were terrible. I went on Reddit and I was able to figure it out in a few minutes. That kind of situation is where you might want to use those sources, but other than that, there are, there's crowdsource is not really the right term. I think open resource is what they use, but there's textbooks like that where experts are coming together and creating these free online textbooks to use. Like I used one in my history program for US history that, quite frankly, was a great book. All right, then we'll get you the mic.
Some of the medical sources I look for are behind paywalls. Are libraries good places to get a one-time article behind a paywall? Like if I look at.
Absolutely. So I know here, most libraries have, if they don't have access to an article that you're looking for that's behind a paywall, they can usually request it through interlibrary loan. Academic libraries don't typically charge for that. Public libraries, it depends on the public library.
Right.
So I know the one that's in Moab, I think charges $5 for each one. The one I worked at, you had 5 free ones before they started charging you.
I'm looking at things like JAMA, New England Journal, those types of things, that paywall,
Yeah, so they'd definitely be a good place to look.
to see if
know.
I can find a cheaper source or free source behind
Exactly.
the paywalls. Okay.
But you may be able to find a lot of academic libraries, the bigger ones, I can't think of the one here, University of Utah. If you go on campus and use the computer in the library, you can actually access most of the journals without having a login, which can be a pain having to go on campus, but if you get the free article. Oh.
Well, they're
With those,
right. Well, drug companies mainly are the sponsors of most studies.
yeah.
Work in that field. Yeah.
And you can check that, definitely check where they're getting the money from, if they're being paid. There's a resource that you can use. I know Roseman offers it. A Web of Science will often tell you where the funding has come from. Reading the article, oftentimes they will list a grant number and you can find out where it came from. So it is all about verifying information. That is the big takeaway for today. Absolutely. Even in medical journals, you want to verify it.
I was just gonna say that when I was looking through some articles like a year ago, if you had a .edu address, so I'd use my daughter's who was at Emory at the time, you could get all those articles. So I don't know if you.
A lot of the time, yeah.
Yeah.
There's
You can get behind the paywalls if you have.
all depends
kid in
on,
college.
yeah, it all depends on, yeah. No, there's a lot of ways around it, but it depends on where you are and which EDU you're at. Any other questions? All right. Thank you.